Greg is a leading expert in the field of fixed full arch dentistry, helping transform single office practitioners into successful implant practices. Would you welcome Greg to the stage?
One of my coaches recently phoned me and said, Greg, I was listening to some call recordings recently, and I'm a little concerned. I don't know what to do next. I said, Amber, let's just listen to it together. We'll find next. Here's how the call went. Thank you for calling ABC Dental. This is Yesenia. How can I help you? I'm really sorry. I'm not going to be able to make my appointment tomorrow morning at 9. My sister passed away. Oh, I'm sorry to hear that you won't make your appointment. We can waive the cancellation fee on that. And can you come in Friday at 2? Now, we teach, coach, and train empathy. And I'm sure that technically, Yesenia did everything right. She said, I'm sorry. She tried to rebook the appointment. But in fixed full arch, all on 4, all on X, it's a $1.5 billion a year industry. Super competitive. It grows by 5 to 8% a year annually. And if you're trying to get those patients, you have to make an emotional connection with them. Why? Because it's not about the what, the product, it's about the why, the motivation. And if you're doing direct-to-consumer marketing, that's all that marketing out there. Google ads, YouTube, Meta, Facebook, Instagram, TV, radio, you name it. There's no trust built in with those patients. You have to build that trust. Now, referrals are different, but we're talking about direct-to-consumer marketing. And if that's what you're doing, it's about that emotional connection with that patient. And it's done through empathy, assurance, and zeal. And so let me tell you, if you're spending all that money on marketing and you're not minding your store by knowing what's happening, you might as well flush that money down the toilet. Because that's why you're not having the success you're looking for. So the 2 points really that are most important, making that emotional connection comes through empathy and comes through assurance, which is all about your USP. So what's USP? Your unique selling proposition. Now, let me start again with empathy. One thing I know about empathy, it's kind of like communication. Everybody thinks it's happening. Most of the time, it's not. Empathic listening has to do with paraphrasing, identifying with the person you're listening to. Now, granted, the next generation, those in their 20s, now I'm not going to bag on them. I have a kid who's part of them, love them to death. If somebody calls up and says, I'm having a problem with my upper plate and it really hurts my upper right side, so I really just don't wear it anymore. Now, can you really expect a 24, 25-year-old to exactly identify with that? Probably not. They probably have most of their teeth. But can they identify with being annoyed? I don't know. Do they have any siblings? Anyone? Yeah. That's what we're talking about. We're talking about helping them to identify with the annoyance, identify with the feelings behind the facts. That's what empathy is all about. And then it comes to the assurance. The assurance are all about the USPs. Now, granted, a lot of you are from DSOs and big groups, and of course you have your mission and your vision and your values, which are critically important. Those overriding keys that everybody should know in each of your individual practices. But each practice has that little bit of element that's different from the next. Anybody here live in a big metropolitan area? I do. And I can tell you that in Metro Phoenix, the east side is a lot different than the west side. So each of those practices have their own unique elements. Each doctor has their own unique elements. Who's delivering the care? And so understanding what sets you apart from the guy down the street. Again, $1.5 billion industry annually just in fixed full arch. We're not talking about all the rest of implants. And growing. Why do you think the Clear Choices of the world, the Nuvias of the world, shall I continue? New players in the market all the time. Everybody's trying to grab a piece. So knowing those one or two or three things, and everybody in the clinic, because they're medical clinics for the mouth, should know what they are. From the C-suite down to the janitor. From those conducting, everything clinical, from the doctors, all the way to the front desk. Everybody knowing those USPs. So the empathy from beginning to end, initial inquiry, front desk, taking of the records, during the consultation, when they come in for smile design, or whatever you call it, surgery day, post-op, final delivery, the whole experience. And then knowing what sets you apart from the guy next door, that's where you actually get the value for your marketing dollars. That's what sets you apart. That's how you get your piece of the pie. That's why making sure that you know what's happening in your clinics all the time, listening in, teach, coach, and train every touch point of that patient journey. That's where the investment is critical. So 2 things I want you to remember. 1, do you know what's happening in your clinic right now? Do you listen in on that initial inquiry for that consistency across the board? And second, does everybody in your practice, if I walked up or you walked up today and said, what sets us apart from the guy across the street when it comes to those big cases? Can they identify that? That's how you get the most for your money. Thank you.